Hi everyone, welcome to another episode of Ask Kate, brought to you by the Children's Tumor Foundation. Today I'm going to be finishing up a series of videos we've been doing where I'm responding to questions that came to us when our science team did a really fantastic Facebook Live event back in February. Today's final question that I'm going to respond to came to us from several different people where they were asking about the different aspects of living with NF1 and pain. So for some people with NF1, this is not a significant part of their experience, and for others it really is. So we're going to approach it from a couple of different angles. Some of the questions were asking about more generalized pain syndromes or chronic pain in NF1. This could be what's called neuropathic pain. This could also just be sort of general pain that is hard to identify where it's coming from or why you're having that pain. The other type of pain that I was asked about is really more localized pain that can happen because of dermal or subcutaneous neurofibromas, which are those small benign tumors that we see kind of on or under the skin that can happen really anywhere for someone with NF1. So let's talk about that first. So when we're looking at pain that's being caused by a specific neurofibroma, so this can happen maybe if it's interfering with your function, like perhaps you have one right on your wrist and you're trying to write and you're always banging your wrist, or it's on the hip where your jeans or your pants hit, or on a bra strap, or some other way that it's getting irritated all the time, then they can actually become quite painful. So really the most common way to deal with that for most people is that they have them removed. So you can see a plastic surgeon or a dermatologist and talk about their surgical removal of neurofibromas. If you have a particularly large one or just one that's really causing you a lot of pain, then that's an option. It will leave a scar, so that's something people need to consider. There's also something called electrodesiccation. Electrodesiccation is, we've talked a little bit about this in previous videos, but basically they use high volt electrical current to kill the tumor tissue and get rid of those neurofibromas. The advantage of this procedure is that they can usually treat a lot of neurofibromas in one session, and there's less scarring. It can be difficult sometimes to find a provider who uses this technique, and so if you want to reach out to me, I'd be happy to try to connect you with somebody. I know that this is, right now it's a little bit limited, but I'm always happy to talk and to see if we can find someone for you. So jumping into a more generalized pain syndrome when you have NF1, sometimes for people living with NF, and this actually can happen, pain is actually a really big part of schwannomatosis particularly, and in NF2 you can see this as well. And so sometimes there's pain that you can't say, oh, I have this pain here because of this specific tumor or this specific reason. You're more just living with this general, really can be very debilitating pain. And it's very difficult for people, especially when it feels unexplainable and you talk to your neurologist or your neurosurgeon or whoever, your primary doctor, and they seem a bit lost, a bit helpless in how to treat your pain and really understand what your experience is. So I'm going to give a big push for something that has become very popular in the past probably 10 to 20 years. I've been a pediatric nurse for almost 20 years now. I had to think about that. And I've seen it in the course of my professional life just start to really blossom and get the appropriate attention, which is for pain management teams. So these are teams of people that are usually comprised of, you have medical doctors, massage therapists, sometimes there's chiropractors in there, psychologists, social workers. There can be a lot of different types of people involved in these teams. Initially, you saw it a lot for inpatient care, and now we see them running entire clinics in medical centers where it's just the pain clinic, and it's where people go to talk about their pain and try to get some help. The nice thing about these teams is that they really take a multidisciplinary approach. And so they're not just going to say, here's a prescription. That might be part of it. That might be something that you need to manage your pain, and that is okay. But there's going to be other options as well. So they have things like biofeedback and massage therapy, acupressure, acupuncture. They might have chiropractic care, working with things like resiliency, mindfulness, and meditation. One thing that we understand about pain is that it's not just a physical experience. It's actually very much an emotional experience, a mental experience for people. And so it's incredible what your mind is capable of when you learn some skills about how to say, okay, I can't change the amount of pain I'm experiencing today, but I have the power to change how I respond to that pain. And I don't say that lightly, and I don't want anyone to hear me say that and say that I'm telling you that your pain is not real or that it's in your head. That is absolutely not the case or what I am saying. what I am trying really to communicate is that you have more power than your pain is letting you believe. And so there's this connection between pain, fear, depression. They're all very much tied together. So the nice thing about a pain team clinic or a pain management team is that they can really approach it from every direction, which can be very powerful in getting you some actual relief and improving your quality of life. So if you'd like more information about that, if you want to reach out to me and say, this is the area that I live in, is there anything near me? I can't promise anything. I know it can be difficult if you live in a more rural area or somewhere not near a big city, but I am always here to try and help, and I would love to hear from you. If you have been treated by a pain management team and seen any improvement, or want to share your experience, I would love for you to leave that in the comments. I would love to hear from you guys about kind of how you've lived with your pain and what's worked or what hasn't. And what's felt like you've gotten some success or some improved your quality of life. I'd love to hear from the community about that. So whether you want to send me an email or leave a comment that everybody can read, I would love that. Have a great day, everybody, and I will see you next time.